Greetings. Let me share this case of colon cancer in 40s. This is important because current guidelines are leaning towards decreasing the screening from age 50 to 45. So this is a story of a young woman who was in her 40s. This has happened in the midst of this COVID pandemic. She's been having rectal bleeding for several months, off and on, without any change in her general health. In fact, she gained weight during the COVID-19 pandemic. And a few weeks back, she developed a cramping abdominal pain that worsened, and she was unable to move her bowels, and every time she tried to move her bowels, she started having rectal bleeding. And she came to the emergency room, and after evaluation we did a CAT scan. As you can see, she has a rectosigmoid intussusception going all the way into the rectum. And because of the COVID, we did an emergency endoscopy, taking all the precautions that are required to be taken while waiting for the COVID test. We didn't wait for the test to come back. We took all the precautions at the University of Texas MD Anderson Cancer Center and performed an emergency endoscopy. So the room was covered to avoid any contact with the virus if it were to be present. Everybody had donned the PPE according to the protocol. An endoscopy staff member was at the door of the room to prevent anybody from entering the room, and the procedure was done under general anesthesia, and these were the findings. I must share with you that I did not have the opportunity to record the movie, which I record on iMovie. So as you can see here, on finger insertion, a mass was felt just above the anal canal, and you could see the intussusception of the cancer. Subsequently, she underwent laparoscopic reduction of the intussusception. One must keep in mind there are a couple of options. One option is to consider urgent surgery and resect the cancer. And because we could not prepare the colon, in that case one would have ended up having a colostomy or a bag. Instead, at the MD Anderson Cancer Center, I must admire my colorectal surgical colleagues who worked very hard to do laparoscopy and reduction of this intussusception. That is, somebody pulling the intussusception from above while another surgeon pushed it from below. And it was a success. And after 48 hours after reduction, we performed an endoscopy, and you will see the findings here. There is quite a bit of edema in the rectum and sigmoid colon, and as we go up at about rectosigmoid junction and close to distal sigmoid, we encounter this large obstructing cancer with a small lumen. We started the endoscopy with a pediatric scope, and then we could not go through the tumor, and you are seeing the findings of a slim scope endoscopy. As you can see here, we tried to find the lumen, and we found that the lumen was where we initially tried, and we used a water flush continuously to open up the area, and then define the true extent of this cancer, which was quite a long segment of cancer, as you can see here. Now we reached the top of the cancer, and then we reached the cecum, and on the way back we cleared the colon of any other polyps. Actually, there was one other flat lesion that we removed. Subsequently, she went home, and then a few days later she underwent a laparoscopic surgery and resection of the cancer along with the lymph nodes and primary anastomosis. This treatment plan of doing one laparoscopy to reduce the intussusception, followed by colonoscopy to define the cancer and also exclude other possibilities, followed by another surgery, has given her the best outcome without the need for a bag. In fact, she has done very well, and she was discharged home 3 days after the surgery so that she could celebrate Thanksgiving with her family. Thank you.